Greetings and welcome to this profile of healers from around the world. And this week we're here with Tioma Allison in a little area outside of Kingston, Jamaica. And Tyoma is a nurse, midwife, herbalist, and she might add a few other things onto that. But she's going to share a little bit about her artistry as a health practitioner. Greetings, Tyoma.
Greetings, hello. How are you?
Very good, very good. To have the opportunity for you to share what comes through your spirit, because here in New York, you're known for your herbal walks at Prospect Park and just all the information. And, I can't begin to say how many women I know whose babies that you have delivered. you know, I mean, it's pretty amazing. So why don't you, since I'm mentioning about babies, pregnancy, why don't you talk a little bit about some of the plant life there or some of the things that you actually use in your practice?
Sure, I'll be happy to. And I just want to say it's really an honor. Thank you so much for the opportunity to share what information I've garnered over the years. I'll talk a little bit first about New York and the herbs and supplements and some of the things that I used there that were amazing, because I want to give them honor too, and just, have people know what's out there. Many people know about red raspberry, of course. That's like the pregnancy herb. Is actually, boxed tea made, a few of them actually, pregnancy tea and so on, that are sold to pregnant ladies, and it's a wonderful herb. I can't say enough about its benefits and its beauties. But red raspberry is known to tone the muscles of the pelvis and the uterine muscle, and so it really helps women to have easier and less stressful and painful births. It also, one of the things that I found in my practice is that because it tones the muscles of the pelvis, it holds that baby in a good position. And so you have there's less opportunity for the baby to lie asynclitically. For example, the head is not straight down, and asynclitic lie you can spell a difference between a 1 or 2 day labor and 10-hour labor maybe. And so we want the baby to be in good position, not to be posterior, not to be asynclitic, and not to have the room to say, turn from the vertex position last minute. So I found red raspberry is really helpful in that way. It's also extremely nourishing. It's got a bunch of vitamins A, B complex, C, E, lots of calcium and iron and potassium, phosphorus. And remember that when herbs are like concentrated foods, very often. An herb like this is, certainly. And so what you're getting is easily assimilated iron, easily assimilated calcium, which we can't always say for, like dairy products and, ferrous, the iron compounds that they give, ferrous sulfate, that they give, which is not easily assimilated and which is hard on the system, hard on the stomach, it may cause constipation. So you want to look to the herbs, you want to look to your foods to, find what you can there, especially in a delicate time like pregnancy. So, we talked a little bit about, the toning properties of actually fragrine, which is an alkaloid that allows red raspberry to perform its toning function. It's also thought to be really helpful in terms of its nourishment when you're producing breast milk, because we always say keep taking your multivitamins, your prenatal vitamins while you're breastfeeding, because we want you to be able to pass on those nutrients in the breast milk. But all the better if you can take an herb such as red raspberry or nettles, or wonderful moringa, which we're going to discuss in detail, in order to have these, again, very easily assimilated and healthful vitamins and minerals. So red raspberry is one we use a lot, and it will continue to shine because women have discovered how very powerful it is, and many of the midwives know how wonderful it really is. So you don't have to belabor red raspberry. It's also very good for fertility. That's an aspect that's not really mentioned. Fertility, that and nettles, very very good fertility herbs. Nourish the body into a fertile space. And red raspberries, that's amazing. It's good for everybody in the family. It's really just can be a wonderful tonic. You can make a big batch of it and put it in, use it as iced tea with a little squeeze of lemon. It's really helpful. And the other herbs that I've used are, again, nettles, very nourishing, very good tonic for the kidneys, and good fertility herb as well. So we use nettles. And if I have a woman that, for instance, is having some problems with her pressure, which often, there are stresses, particular stresses that are that we find in pregnancy itself, where women might have issues with becoming a parent for the first time or for the fifth time. They may be having relationship issues, their economic issues, financial stuff that's going on. So all of this stress can cause blood pressure to rise. As we know, the blood volume increases in any case. And, a woman may not be as active as she may have been, in her pre-pregnant state. But we really encourage activity, exercise, because that makes things so much healthier in pregnancy. So if blood pressure is starting to rise, particularly in third trimester when it's the greatest stress on the body, I like to give hawthorn, and usually I advise people to get hawthorn tincture, which is it's in the apple family, related to in the rose family rather, related to the apple, and so it's really not toxic. Anything you can take too much of, I sent you a picture of the big bottle of tincture that I made when I was in New York. And I left it on the counter. My husband, whose pressure is a little borderline sometimes, decided more is better, and so he took maybe like a quarter cup of the tincture, and later that day he had an episode where he I wasn't there at the time. I should have told him. He had an episode where he passed out, actually. And so, of course, your blood pressure can get so low, especially when you're dealing with a tincture where it's very strong. So you don't take it like it's water, but, you take it advisedly, 5 and 10 drops. And almost every time blood pressure starts to go down, unless it's related to toxemia.
So I was going to ask you if for preeclampsia, is that something where hawthorn might be useful?
It will bring down the pressure somewhat, but because that whole pathway is very different, to pregnancy-induced hypertension or just regular hypertension, you're not gonna get rid of your
That's an important distinction.
Sorry?
That's an important distinction.
Yes.
Right.
Oh, definitely.
Right.
No. That's a different disease, and it's got its ground also in poor nutrition, but also in a lot of stress. But once that process starts, maybe you can hope to slow it. But really, we're talking about just delivering the baby that's secure for.
I understand.
Yeah.
You're mentioning botanicals, but I'm just curious about magnesium. If that would be something that you would use in various forms, right?
Absolutely, especially in acute, because of course, hawthorn is very magnesium rich. But in acute cases where you just need to get that pressure down, the person has come to you late, or you're noticing that there's this hypertension that's stubborn. Magnesium can be really, really helpful. Right. Very helpful indeed.
So, believe it or not, we've actually gone through a good amount of time. And
what happens.
I know. And I want to let folks know that at some point we're going to ask Tyoma to do some virtual workshops on making tinctures and just actually demonstrate what you actually do with the herbs once you have them. And I think people would really look forward to actually, a how-to, kind of workshop, because you mentioned tinctures and extracts, but not everybody knows how to make those things. But before we